with Dr. Benita Zahn.
Welcome. We've heard many stories from the front lines of the pandemic. Among those, well, they've been told from the people who have had to hold the hands of the frightened, soothe the souls of the sick, and support families. These are the chaplains. It's been a life-altering experience for many. Chaplain Richard Hoffman works at Saratoga Hospital. He's also on the ethics board, of which I'm also a member. And he shared some writing that helps us all better understand what this most unusual time has been like. Welcome, Chaplain Hoffman. Good to have you with us.
Well, thank you for having me. It's good to be here. I want you to know that I have my mask right by my side, and I am alone in this room, so I'm going to do this unmasked.
Okay, you're rocking it. And I'm at a social distance from the person who's working in the studio, so we're good here. Early on in the pandemic, I spoke with two chaplains from St. Peter's Hospital, and they spoke to the emotional trauma, I think is the best way to put it, that they were experiencing while trying to support the patients and other healthcare providers. Give us a sense of what it's been like for you, and from the beginning to now, as the curve flattened and life returns to normal.
Okay. I firmly believe that necessity is the mother of invention. So when the COVID restrictions started to be adopted by Saratoga Hospital, I had to find new ways to do spiritual care, particularly for patients and their families. One of the restrictions that we have, and I think most of the hospitals in the area follow this, is except for unusual needs, family members are not here. So our patients are here alone, without family support, at least physical family support. And so in order for me to interact with families, I've had to use my smartphone. It has become an essential tool in the work that I'm doing with families.
So you use the smartphone, but now in a sense that puts something between you and them. So how do you bridge that gap and make it the same kind of real interpersonal experience you had prior to this?
You're right. I think that that's definitely one of the challenges of using a phone like that. In a particular situation, and I alluded to it in the poem, I was able to at least see the patient, and the patient was able to see me through a window that is ordinarily opaque when the patient is being cared for by a nurse or physician. So we were at least able to make eye contact. I saw her facial expression. She saw my facial expression. So in my mind, that helped put a little bit of a so-called touch.
You penned some poetry, two pieces that you shared at a recent ethics board meeting. What prompted you to do this writing, Chaplain Hoffman?
Well, self-reflection for chaplains is essential for us to take care of ourselves and also to critique the work that we are doing. All board certified chaplains, such as me, do at least a year's worth of training known as clinical pastoral education, and that pretty much is reflective writing about our interactions with patients. So the poetry for me is a next step to be even more creative. I'm interested in how words work together, what words mean. Poetry gives me the freedom to explore that. Poetry also gives me the means to make allusions that aren't necessarily in health care, but help me to understand it better, and hopefully those who read my poems.
There's one of the two pieces is called I Am Chaplain. I'm going to ask you to read the second and third stanzas, paragraphs from that, and we'll put that up on the screen because I think they're really powerful and speak to the time. We can get the first graphic up. It starts, let the director know, when I walk the hospital halls. There we go. Please, Richard.
Okay. When I walk the hospital halls, I pray without ceasing for all. I notice masked faces that hide, all but the open eyes wide. Blank stares that ask when this will end, knowing that more infections is the trend. Can't I find ways to cope, even rediscover hope?
And please continue.
Yes, a patient upstairs needs to talk with me. COVID positive, it will not be easy. No longer a matter of just washing hands. Maybe I can stand in the doorway. Not a chance. My smartphone has become essential as I give spiritual care through a dial. The patient and I look at each other through a murky window meant to cover.
And then you ask a question near the end of this. Would you share that with us as well?
Absolutely. When will the infestation end? Will we ever have a chance to pretend life is back to what we had, or to think that this is not too bad? Doubtful handshakes and hugs between friends have become ancient ways restrained by new disease made rampant by novel coronavirus. Our isolation dims hopes of needed tenderness.
And I think we will leave it there. I think you've said it all and give us plenty to think about and much to reflect on. Chaplain Richard Hoffman, Saratoga Hospital, thank you. Continue the great work and stay well.
Thank you, Benita. Thank you for having me.
And thank you all for joining us. We'll see you next time.